There has been serious questions and yes, fear that women living with HIV/AIDS may or may never be able to have children devoid of the virus. This fear has actually left many women living with the virus to doubt their chances at taking the risk. Accompanied is the societal challenge that comes with it, the stigmatization of victims of this virus. Is it possible for a woman living with HIV/AIDS to have a child that is negative to the virus, a healthy baby? Welcome to Mata Africa, a program that focuses on serious issues regarding women and children in Africa. And with me here today is Dr. Uche Ayanwagu. Uche is a Nigerian trained medical doctor who holds a PhD in clinical epidemiology from the University of Nottingham, UK, and currently works as a clinical fellow in acute medicine at the Royal Derby Hospital, Derby, and also an associate postdoctoral research fellow at the School of Medicine, University of Nottingham, United Kingdom. You're welcome, Dr. Uche.
Thank you very much. It's good to be here.
Thank you. So, sir, can you help enlighten us on perinatal transmission of HIV/AIDS, which is also known as mother-to-child transmission of HIV/AIDS?
Okay, perinatal transmission of HIV/AIDS simply refers to the spread of HIV from a mother who is HIV positive to the child, either during pregnancy, either during labor, or during breastfeeding. So it's sort of, the perinatal period is the period between 22 completed weeks of pregnancy up to 7 days after birth. So within this period, perinatal transmission of the virus can occur.
Okay. So is it possible for a woman that has tested positive to the virus to have a child, to have a negative child?
Yes, it's very, very possible.
Okay.
The answer is a very capital yes. It's possible for a HIV positive woman to have a HIV negative child once certain management processes are in place and the person is monitored throughout pregnancy, delivery, and after delivery. So it's possible.
For the sake of the audience and then for the society that do not know how these things work, can you please shed more light on how this transmission, how a mother can actually transmit this virus to an unborn child?
Okay, basically I would say 2-3 ways.
Okay.
One could be during pregnancy itself, then the second is during labor and delivery, then the third one is through breastfeeding, through the breast milk. You know, the virus can be transmitted during the final trimester, the last stage of pregnancy, from the mother to child, because the HIV antibodies, the HIV virus itself can cross the placenta at this particular period to affect the fetus. So the management of labor too can cause transmission because the blood of the mother may come in contact with the blood of the child and the infection can occur at this particular stage. Then again, the virus too can be secreted in breast milk, and once that happens and that child is breastfed, then the child can be affected. So basically 3 ways: during pregnancy itself, during labor and delivery, and during breastfeeding.
Earlier you mentioned that a woman can have a healthy child devoid of the virus if being properly well taken care of in a hospital or through medical experts.
That's correct.
So, what strategies are being used here to help a child?
Okay. The strategies, I think I will also list 3 of them as well. The strategies include giving them antiretroviral therapy, that's the HIV drugs, or the one we call highly active retroviral therapy, HART. And this is given during pregnancy, during labor, during delivery, and after that. Then another way to prevent it is trying as much as possible to avoid vaginal birth. So most HIV positive mothers may have to undergo a cesarean section to deliver their child. Then another way to prevent it is giving antiretroviral therapy to the child. We call it antiretroviral prophylaxis. So you can give that to the child. Then another way to avoid it is to avoid breastfeeding. To avoid breastfeeding throughout this particular after the child has been born. So antiretroviral drugs given antenatally during childbirth and even given to the child after within the first 4 to 6 weeks of life. Then the second part is delivery through vagina. Should be avoided. Delivery through vagina should be avoided. But there are certain cases too where in resource poor settings where these ladies would have to undergo vaginal birth. So in this case, they're also given drugs during delivery, and the child can also be placed on some drugs after delivery just to make sure that any virus that the child could have come in contact with will be dealt with. But the best option is for them to undergo cesarean section, and that would help to prevent the child getting the virus during delivery. And again, too, a HIV positive mother can deliver vaginally if the viral load is undetectable. So if it gets to a stage where we can't detect the viral load in the blood, such a mother too can deliver through this. But to be on the very safe side, cesarean section is advised. Then avoiding breastfeeding as much as possible. We also know that this poses a question when you think about the society where you have the African culture, where you have the families around, everyone wants to question why you're not breastfeeding the child. So this becomes a little challenge to the mother. So in this case too, we encourage that even if you must, in as much as this is totally discouraged, even if you must, the child should never be given mixed feeding. If it's breast, just give breast alone, then continue on your antiretroviral drug as the mother. Then the child is also placed on antiretroviral drugs as well. Then don't do mixed feeding, bottle feeding, water and breast milk and the rest of them. So the best actually is to avoid breastfeeding entirely.
Someone once wrote to me. She mentioned she's positive, and immediately she realized she was positive. She went to a hospital where they gave her the ARVs, and of recent she's been actually faithful taking those drugs, and then of recent she went back for a test, and then she was declared negative. Not that she was negative. She has been to several hospitals where they declared her positive. But she said probably because she has been taking her drugs religiously.
Yep.
So she's now being declared to an extent negative. Does this still affect a transmission either from mother to child or from wife to husband? Can you please shed more light on this area?
Okay. There are two basic things that happen during HIV infection. Number one is it affects the CD4 cell count, that's the body's immunity. And when it affects the CD4 cell count, the body's immunity is low, so the CD4 cell count will be low. Then again, the virus itself begins to multiply in the body, and you have the viral load rising. So it's usually a case of viral load is rising, and the CD4 cell count, that's immunity, is reducing. So as a result of this, when you test someone, the person will test positive to the HIV antibodies which the body is trying to develop to help fight the infection. Then we check the CD4 cell count, is usually on the low side. You check the viral load, is usually on the high side. So what I think happened to your friend is that she has been very careful with her drug, and that has helped to reduce the virus in the body, in the blood. So when she tested, the virus was almost undetectable in the blood. It doesn't mean that she's completely negative, but at this stage the virus is at an undetectable level, and there is something we call U is equal to U. That is undetectable is equal to untransmissible. So in this particular case, a woman who is HIV positive can have sex with a husband without condom because the chances of infecting the husband is very, very low. And in this case, too, a woman can be allowed to have vaginal birth because the chances of infecting the baby are very, very low. Then in this case, too, the lady won't be able to transmit the virus, though she has it. But because it's highly undetectable in the blood, she's unable to transmit the virus to any other person. But all the same, too, concerning childbirth, it's also better that we err on the side of caution in people like this so that you don't just risk anything. But I had a chat recently with a friend who works at Ministry of Health in Delta State, and she said that almost all the HIV positive mothers they have who were faithful to their drugs, all had children who were completely negative. It's only one that they have found a case, one in 10 years, that they found a case of a woman who was positive, taking her, or assumed to be taking her drugs, and unfortunately had a HIV positive baby. But you can see that the chances are very,
Slim.
very, very slim. Yeah.
So during pregnancy, it's always advised that women stay close to their husbands.
Yep.
That's sexual intercourse being introduced. And what if in the case whereby both the man and the woman is positive?
Yep.
And then is there any risk? And how will the child like get in contact with HIV/AIDS if the husband, as the father,
Yeah.
gets close to the mother
Uh,
at the embryo stage?
okay, no. No,
Okay.
the answer is no. If they have sexual contact and the rest of them, what they do is just to cross-infect themselves. I mean, assuming the lady is positive and the man is positive, and they can cross-infect themselves. In as much as this is possible, HIV positive couples are always advised to still use condom, because there are different strains of the virus you can also transmit. You may have a more resistant one. You don't say my wife is positive, what do we have to lose? And you end up transmitting the more positive, more resistant ones to your wife, and vice versa. So that is discouraged. But all the same too, when HIV positive couple meet and have sex and the wife is pregnant already, doesn't have any chance of affecting the baby per se.
Okay.
Yeah.
So for a positive woman,
Yeah.
what is the first step she should take immediately she discovers she's pregnant? Or let's say a woman is positive and she plans getting pregnant. What are those things she should take into consideration first before getting pregnant? Are there things she should do?
Okay. I want to assume that this HIV positive lady is already seeing a doctor, is already under care, taking her HIV drugs and the rest of them. From my little experience working on HIV units while I was doing my residency in public health, we plan it together with them based on the factors on ground. We can advise, okay, madam, you can get pregnant now. You can attempt to get pregnant at this particular stage. And most of the things we try to determine is the person's health status, generally. Then you also determine the person's viral load, CD4 cell count, because pregnancy itself weighs every lady down. So if someone is already immunocompromised and is also getting pregnant again, it worsens the situation. So in this case, you have to work up and make sure that all the parameters, all the necessary parameters are okay. Then in that case, the doctor can advise you, okay, blood level is okay, viral load is low, CD4 cell count is high, you are doing well, I think you can attempt to get pregnant. So when that lady gets pregnant, the lady is followed up. These are special cases. Under obstetrics and gynecology, there are special cases. They are monitored by both the gynecologist and obstetrician, and they're also monitored by the HIV physician, so that they can monitor these people, make sure that they're on the correct antiretroviral, and they monitor them. Then towards the end of the pregnancy too, neonatologists are also part of the management of them when they deliver the baby. So it's sort of a teamwork, everybody working together. So the best friend a pregnant HIV woman can have, or a woman who is intending to get pregnant, is your healthcare provider. You really have to be close to them and listen to them and follow all the advice they give.
One other question. For a woman who is positive,
Positive, okay.
how does she approach a negative
Partner,
partner?
okay.
Like you discover your wife is positive, and then you still have a child to go,
Yeah.
or probably you're just starting a
Yeah.
family, and then
Yep.
what's the process like? Is it through mating or through sexual intercourse or through some insemination or something?
Okay.
Because we've been hearing various stories
Okay.
of how people go through insemination and some still. So we would really want to know.
Okay, in this particular case now, we have so many HIV discordant couples, and most times these are wives being pregnant, and wife being HIV positive, and the husband being negative. The male biology actually is in such a way to is a bit defensive against HIV positive. I've always joked with someone and said that even a HIV negative man can mate with a HIV positive woman, all you need to do after sex could just be to wash off yourself and urinate. That alone might be so protective. But the reverse is the case for women, because they're more on the receptive side. The man pours in a HIV positive sperm into you, and in the lining of the vagina and the rest of them, they have a whole lot of white blood cells that will pick up all that the HIV virus will definitely attach to. So that's why it's a bit difficult for the lady. No, now in this case where the lady is positive and the man is negative, yeah, it's advised when the lady wants to get pregnant too, both of them will have to approach the doctor, then it's planned very well. It's best also done when the viral load is low for the lady. Then you can encourage, have unprotected intercourse with your husband. So when the viral load is low, CD4 cell count is getting up a bit. In that case, the chances of the lady infecting the husband are very, very low. Okay. And because the chances are low, then the man can have sex without protection and will be able to impregnate the lady. Okay. So my little experience too, working in the HIV unit here in FCT and at the teaching hospital at Newi, is that both of them will sit down and we plan it together. The couple will sit and say, okay, now you will, for this particular month, should try to have sexual intercourse without protection. And that is based on the available parameters in terms of CD4 cell count, the health status of the lady, and the viral load.
Okay, there is no need to give the man some ARVs to take during that process.
Now, the man can also have prophylaxis for about 1 month. Okay. If we assume that the viral load for the lady is quite high. So to be on the safe side, take prophylaxis, mate with your wife without protection for the 1 month.
So it helps, and
it helps.
The chances are cleared.
The chances are very, very, almost completely cleared off.
Okay.
Yes.
So for children, for unborn babies who their mothers are actually unknowingly infected, either because there are cases where women don't even go for antenatals and all that. Yep. So there was a time at FMC Makodi, a child was born tested positive. So I don't know, are there things we can do? What are the things, how are the ways we can help such babies?
Okay. In as much as every woman is encouraged to undergo antenatal care because it's very important. I know so many women who happen to know their HIV status only during antenatal, the first test, then they discover they're HIV positive, then they commence on the drugs and that helps their children. But if someone is unfortunate to have antenatal care and goes on to have a child who unfortunately is HIV positive, then that child is placed on antiretroviral drugs. And unfortunately, the child may be on it for life to help. So the child is placed on antiretroviral drugs the same way an adult is placed on antiretroviral drugs, and the child has to take it for life.
Okay. Yeah. So in percentage, can you tell us the chances, in percentage, the chances of a positive woman living with HIV is having a healthy baby in percentage?
In percentage, if I'm to say now, based on the available statistics, there is no particular place where it is written, but if you look at the records around us, if you look at the information around us, if I should dwell on the statistics my friend gave me from Delta State, where they have only 1 positive case in 10 years, you can see that HIV positive mothers who actually have the antiretroviral therapy and they're under complete care, the chances, I think they're almost 99%. They also almost have a 99% chance of having a healthy baby who is HIV negative.
Okay.
Yeah.
So finally, can you please refer to us some NGOs and hospitals in Nigeria that helps people living with HIV/AIDS?
The HIV program, I think it came up during President Bush's administration, where they had this presidential initiative for the control of AIDS, PEPFAR, and they established in almost every hospital. Then we had NACA, we have SACA, and we have LACA, all agencies involved in the control of AIDS and HIV. So I think every government hospital, be it federal, be it state, they all have centers there. Many private hospitals do have as well. Then there are so many NGOs too who help. But to have adequate and continued care free of charge, then the person should go to the nearest general hospital or the nearest federal medical center or teaching hospital where the HIV positive lady can access all the care and all the care he or she needs throughout her life or throughout the period of pregnancy, in fact, throughout her life, not just pregnancy period alone. And treatment is completely free. So this makes it possible for people to have access to it.
Wow, it's been wonderful having you on the show today.
Thank
So,
you.
dear viewers, with these plenty points and facts, I hope you've been convinced and not confused. Sorry about that. Now you know HIV/AIDS is not a death sentence. You can still live a normal life even when tested positive. So it's not a death sentence. You've heard from Dr. Uche Ayanwago. It's not a death sentence. You can still have your child healthy. You can still live a normal life like every other normal mother there. So the fact that you're tested positive doesn't mean you shouldn't take chances at sex, at being pregnant, you know. So we've come to the end of the show today, and I'm leaving you with a message. Say no to stigmatization. Say get tested today. Take your drugs religiously, like yes, religiously. Eat well, exercise, play safe. Be happy till I come your way again with another wonderful guest and another interesting topic. I still remain your host, Patience Ekonyohe Daniels. Thank you so much. And thank you so much for coming on the show.
Yeah, thank you. It's my pleasure being here. And thank you, everyone, for listening.
Thank you. So, bye-bye.